Module Overview. This module is a deep dive into one of the most critical and challenging parts of UK and EU healthcare interviews: clinical scenario questions and ethical dilemmas. These questions test more than clinical knowledge. They evaluate your judgment, decision-making under pressure, understanding of policies, professional values, and capacity for empathy and leadership. For regulated professions like nursing, medicine, allied health, and social care, it is common for interviewers to assess how applicants respond to hypothetical but realistic clinical or ethical situations. This ensures that the candidate not only has technical proficiency but also aligns with the core values of the NHS or EU healthcare systems. Section 1. What are clinical scenario questions? Clinical scenario questions are hypothetical patient care situations designed to test your clinical decision-making, time management, ability to prioritize awareness of patient safety, multidisciplinary collaboration, communication skills. Example: you are the only nurse on duty in a ward with 4 critically ill patients needing urgent attention. How would you prioritize your actions? Your answer must demonstrate awareness of triage principles, ability to delegate clear communication documentation, knowing when to escalate to senior staff. Section 2. Ethical Dilemma Questions. Ethical dilemmas test your alignment with healthcare codes of conduct and values such as confidentiality, consent, dignity, safeguarding professional boundaries, equity, and fairness. Example: a patient confides in you that they're being abused at home but begs you not to tell anyone. What would you do? Key points to show: safeguarding knowledge, confidentiality with limits, duty of care, following policies, e.g., raising concerns, referring to safeguarding team. Section 3. STAR Method for Structured Responses. Use the STAR technique to answer scenario and ethical questions. Situation: set the scene. Task: describe the goal. Action: explain what you did. Result: share the outcome and learning. Even for hypothetical situations, this format demonstrates clarity, critical thinking, and accountability. Section 4. Common UK interview scenarios and responses. NHS nursing. Example: you notice a fellow nurse has administered the wrong medication. What do you do? Correct response includes ensuring patient safety, informing the nurse and senior nurse immediately, documenting the error, reporting via DADIX NHS incident system, supporting colleague without blame, but ensuring patient welfare, allied health professional. Example: a patient refuses to use a mobility aid and insists on walking alone. What is your response? Response should show respecting autonomy, educating the patient on risks, risk assessment and documentation, informing the care team, considering occupational therapy or mental capacity assessment. Section 5. EU interview scenarios. In countries like Germany, Sweden, and the Netherlands, interviews often involve clinical judgment in multicultural or multilingual environments, EU data privacy regulation, GDPR, implications, shared decision-making with patients and families. Section 6. Key guidelines and frameworks. To answer these questions well, familiarity with the following frameworks is essential: UK, NMC Code, Nurses, Midwives, GMC, Good Medical Practice, Doctors, HCPC Standards, Allied Health Professionals, NHS Constitution and Core Values Duty of Candor, Safeguarding Adults and Children, EU, WHO Global Code of Practice, GDPR Patient Confidentiality, Rules Cross-Border Patient Rights under EU law. Section 7. How to prepare for these questions. Practice with peers or mentors using real examples. Stay updated with NHS and WHO clinical governance standards. Read case studies involving patient safety and ethics. Reflect on your past practice and create STAR stories. Stay calm and professional. Show your reasoning, even if unsure. Section 8. Accreditation alignment. This module meets the academic and professional preparation standards of CPD Certification Service, UK, NHS, Leadership Academy, Competency Framework, Health Education England Interview and Assessment Guidelines, GMC/NMC Revalidation Requirements, European Federation of Nurses, Interview Competency Structure WHO Patient Safety and Ethical Practice Guidelines. Summary. Module 8 prepares candidates for answering high-pressure interview questions confidently, applying values-driven clinical judgment, managing ethical dilemmas with professionalism, reflecting real-life clinical experiences in structured responses, meeting the ethical and safety expectations of UK/EU healthcare systems.